Hey guys, so my name is Sergeant First Class Mitchell. You guys should know me, I'm your guys' supervisor. Today we're going to go over something really important because we all work in the medical field, and that's the importance of hand washing in our field. More specifically in radiology, but this slideshow I will go over basically the entire medical field, but I'm going to try to keep it into rad. Okay, next slide. Alright, so the objectives I'm going to touch on. I'm going to touch on the gram-negative bacteria, an event that could have been prevented. The problem, alright, the cause of that problem, or those problems, the solutions to those problems, why effective hygiene is in all of our hands as medical personnel, and then we'll conclude. Cool? Go ahead, next slide. Alright, so the gram-negative bacteria. I know you guys can't really see the screen. You guys can just listen to the story. So, only about 5 years ago, there's this lady named Victoria Newham and her husband. They lost their 24-year-old kid, and he's a skydiver. So, being that he's a skydiver, you would think that being that he's into extreme sports and stuff like that, that maybe he died from a skydiving accident or doing some snowboarding or something like that, because that's what he was into that outdoorsy type of stuff, the pretty crazy stuff. All right, but unfortunately, yes, he was in a skydiving accident. However, that's not what killed him. What killed him is the people that took care of him. The x-ray techs, like me and you. The nurses, the physicians, the doctors, all right? And the reason is because it's sad, but true, they didn't wash their hands, all right? The gram-negative bacteria actually comes from spreading of bacteria from one patient to another. And that's exactly what happened in this instance. The dude was, like I said, was in his 20s, early 20s, and only about 5 years ago they lost their son, their only son, and that actually really sucks. So, how many of you guys have kids, families? All right, so pretty much all of you guys in the classroom right now, and so do I, and that really sucks. All right, and the reason it sucks is because what if my kid had an accident sliding into second base one day, right? And then I bring him in to get an X-ray. But Garcia here did not wash her hands before she saw my kid. And my kid only had a broken ankle. But now he's admitted to the hospital because Garcia spread the germs or bacteria from another patient onto my child. That shit would suck. Yes? All right. So what we're trying to avoid here as not only technologists but as medical personnel is avoid doing that to somebody's family or even our own. All right? So a lot of this is going to talk about how we can prevent this from happening, okay? And I know I reiterate like over and over and over again, wash your hands before a patient and after the patient, correct? And the reason is, and we'll go into it a little bit more, so go ahead, next slide. All right, so something as simple as washing your hands, as I already touched, whether it be through patient care, or how many of you guys have witnessed this? You guys go to the bathroom. Obviously this dude was pooping, okay? He comes out of the bathroom, you're in the middle of washing your hands, and dude comes straight out of the bathroom. I'm pretty sure most of you have seen that. It's freaking disgusting, and it's uncalled for. So before, if that were to happen, I would just be like, man, that's pretty sick, right? Now what I do is I actually, hey man, you forgot to wash your hands. And technically that's what we should all do, especially if it's in a hospital environment. Because regardless of whether you're working on that patient or not, you're in the hospital, those germs are being spread, correct? All right, go ahead, next slide. So the problem. I'm going to read just a few little bullets off of this one. In the United States, 1 in 136 hospital patients become seriously ill as a result of acquiring an infection in the hospital itself. 136. 136. It's freaking, those are large numbers. All right? Every day, 247 people die in the U.S. as a result of healthcare-associated infections. It's equivalent to 767 aircrafts crashing every day, or more than 90,000 deaths annually. Sad, but true. All right, go ahead, next slide. So technically, that's the problem. We're just not washing our hands. Infections are being spread throughout the hospitals. All right, and here at Evans, we're one of them. All right, so the cause. Basically, I'm going to touch on some of the main causes and or some of the reasons why we as techs or nurses or physicians are saying, well, we didn't have to wash our hands, or we didn't wash our hands, and this is why. One of those main reasons is, well, the dispenser is not where I need it to be. It should be right when I walk into the room, I should be able to wash my hands. Or that sink should be right there in front of me before I get to that patient. Here at Evans, what we've done is we've actually put dispensers in every single room. And our rooms here, we have the dispensers and we have the sinks to wash our hands. Either one of those ways is a productive way to wash your hands, whether that be the hand sanitizer or actually washing your hands with water and soap. All right. Again, we're just trying to prevent that infection to prevent us from getting sick, our kids from getting sick, our spouses from getting sick. Okay. Again, the last one is, another bullet to touch on is the lack of accountability and just-in-time coaching. So this is something that maybe we can all improve on. So we're all techs in here, some of us students in here, some of us supervisors in here. What we need to do, right, or what you guys as techs are saying, or even supervisors are saying is, well, I didn't wash my hands because it's not really necessary because, well, when I didn't wash my hands, nobody really corrected me. All right, and it makes sense, right? Obviously, I'm not wrong if I didn't wash my hands because nobody corrected me. Again, we'll go into how we can fix that. Another one is my hands were full. So I'm carrying cassettes or something into my room to go shoot this x-ray. My hands were full. I didn't have time to wash my hands. Or I completely forgot to wash my hands because I was distracted. Because there was something else that I was doing, like checking the patient's name and their full name and their date of birth, right? It seems like it's an okay thing to do because I was doing something else. So not washing my hands is all right. And after all of that happened, my supervisor didn't correct me. And I had to walk way over there to get to the sink to wash my hands. Does that make sense? Next slide. All right, so the solution. The solution, as I touched on earlier, to the dispenser or the sink not being in every room, here at Evans, like I was about to say, there's a sink and a dispenser, or what are those things called again? Hand sanitizer dispensers are in every room. So there shouldn't be an excuse. That's the solution. Put a sink and a hand sanitizer dispenser in every room. And sure enough, we have it. So technically, it shouldn't be an excuse for any of us in the room. Okay. The next is the lack of accountability, just-in-time coaching. So again, that comes down to the supervisors or floor walkers in our case, right? Or the tech that the students are working with. All right, they should intervene. If I see that Gilliam is not washing his hands right before getting this patient, or after reading the patient, the full name and the date of birth of the patient, that he's not washing his hands, I should intervene and say, hey man, wash your hands. Or say some kind of secret word, like soap, something, right? Just intervene. Chips, exactly. Intervene, yes. Whatever works, whatever works. The thing is that we're ultimately trying to do is to get you to wash your hands so that you don't spread infections from possibly another patient that you just got done with. Does that make sense? All right, go ahead, next page. All right, so the other one, my hands were full. Okay, I understand that. We deal with cassettes. All right, and yes, our cassettes are conveniently located in a certain area where they're not going to really affect our patient care. However, not everybody works like that. So if our hands were full, maybe we were carrying shields. Maybe we were carrying all of our cassettes into our room because it doesn't matter if we shoot an x-ray with our other cassettes laying on the table, right? If that's the case, that sink is still there to remind you. Your tech that you're working with is still there to remind you to wash your hands. And again, that little bulb should be blinking constantly in your head saying, hey man, if I don't wash my hands, I can possibly be spreading the germs that I got from room 6, now I'm in room 4 because somebody forgot to clean their equipment after they got done with that patient. Does that make sense? All right. So really what I'm trying to save here, you guys, is not only your lives, the patient's lives, but also the lives of your kids and your family members, your loved ones at home. All right? Go ahead, next page. Go ahead. All right, so effective hygiene is in our hands, like literally. We got to make it a habit. All right, so every time you go into a room, wash your hands. The more and more that you do it, the more and more that you're going to continue to do it because it's going to become habit. When your patient leaves, you've just touched that patient, you manipulated their feet, their ankles, whatever the case might be. There's germs, there's blood. Even though you were wearing gloves to treat this person, there's still germs. When you take those gloves off, the machines you touch, everything has it. There's bacteria everywhere. Wash your hands when that patient leaves as well. Clean off your machines. All right, because the next tech that comes in there might not have done that, and it is now moving that bacteria around. So wash your hands before, wash your hands afterwards, make it a habit. Next is the active feedback. Again, that's going to take the supervisors, each individual tech, going in there saying, hey, wash your hands, or reminding you to wash your hands, or even just right before. What I like to do, I know I've done it with some of you, is when you guys come into the room, I usually ask you, hey, what are the 3 things you're going to do before you shoot this patient? Put them into the system, make sure you wash your hands, full name, date of birth. Pretty simple. If you make that a habit, you're always going to do it. All right? You're going to get that active feedback from one another. Next, no one is excused. So if Garcia forgets to wash her hands beforehand and nobody mentioned it to her, she's going to continue to do that. It's going to become a habit. So if we correct her, right, or tell her, hey, do you know how to wash your hands? Show her how to wash her hands, then no one is excused. All right? And it becomes a habit. I gave her that feedback that she needed, and she's not excused from not washing her hands. Does that make sense? Again, it's data-driven. Data-driven is all those numbers I gave you. 267 plane crashes a year, right? 136 hospitals a year with infections. Every day. Every day. The systems. The systems are those things like the sinks, the hand sanitizer dispensers, me intervening, making it habit. It's all system. All right? So really what it comes down to is effective hygiene is in your hands. It's in our hands. Go ahead, next slide. All right, so just to touch on everything we touched on today. Wash your freaking hands. It's easy. Make it a habit. All right? Before and after. If needed, sometimes during. Right? If you just shot somebody's feet and you like to wear gloves, wash your hands before you apply those gloves. Wash your hands after you don the gloves. And then start on that knee or that chest x-ray that you're about to do. Does that make sense? All right. And then really, again, other than it being in our hands, it comes down to you guys, your guys' personal lives. It's not only your life you're saving, the patient's lives that you're treating, but also your families at home. Any questions? Next slide. None? All right, if you guys do have any questions or want to know where I did my research, go ahead and hit the next slide. My references are right there. Awesome.